I mean, obviously, when you look at Ghana or any African country, there's more. The problems are more than just health problems. So obviously, we have a lack of clear leadership, a lack of selflessness in the political arena or in the leadership arena, and then also a complete collapse of the traditional leadership and cultural system that used to support the people. If you spend any time in Africa, you will realize that people have a spiritual view of life, and homeopathy fits in nicely into that. You know, there's a form of medicine that is gentle, safe, effective, where certain principles, if applied, will lead you to the medicine, that pretty much any substance has a potential to be a medicine. All of those ideas fit in very well with the African traditional view of life. And I think that if we are able to regain our confidence in our traditional way of looking at the world, then homeopathy will be seen to fit in very well within that worldview. In terms of the potential of homeopathy, I think it is good because one, it will allow the leaders, if they have the right agenda, to see that healthcare doesn't have to be expensive. Two, that we don't have to rely on the idea of popping pills for the rest of our lives. And then thirdly, to see that you can do a lot of things for yourself. You don't have to rely on international pharmaceutical companies or people coming in from outside, that there's a lot of things that can be done on a local level.
This is the village called Togbeve. So we've come this morning to do an outreach clinic here. We have already seen some of the patients we treated before, and then we are waiting for the rest. Yeah, this was one of the patients as well that came before. So when she carries her load on the head and she's walking, she feels like falling down. Her walking also is imbalanced sometimes, as if she will fall.
She became pregnant during the second pregnancy. The pregnancy was in the 8th month, and one day she boarded a vehicle and saw that her feet were swollen. And the doctor gave her furosemide, 24 tablets to be taken for 4 days. That is, if you take 6 tablets a day. And on the second day of taking the medication, the whole leg becomes shrinking. Okay. And the baby forcefully came out from her or from the vagina prematurely. When they heard the story, they asked the doctor why she gave the furosemide, and the doctor said she was just making a trial on her. So all those things triggered her conditions. She had a heat sensation from that time, heartburn, and high blood pressure with a tingling sensation and so many other symptoms till today. So the first time she came to me, that was in June 2008. I gave her Natmio, and now she said the heat sensation is almost gone. And now Dr. Khalid Shankar said we should give Sekeli 200C, 1-2 times a day, and then wait and watch.
Yes, furosemide is a diuretic. It is usually given to urinate so that the body fluid comes out. Half a tablet a day or one is more than sufficient.
What is this? How long has this growth been there?
2 years now that the mother said she got noticed.
And he's had frequent doses of malaria. Yeah. This is a 4-month-old baby who's had diarrhea since 1 month old.
Yeah.
Green diarrhea with mucus. The mother was sick for 2 months after birth with malaria. Didn't see a doctor, had no treatment. The baby didn't get enough breast milk during these 4 months. So the baby is somewhat malnourished. and is not gaining any weight.
I would like to thank all the people who contributed financially, morally, and towards my going to India, and even towards the project over here. I owe them a great gratitude, and I hope I will not disappoint them. I will do my best to upgrade homeopathy in the area and then spread homeopathy throughout the whole Volta region and even Ghana.